Hello, should be live, should be working, all things considered. On the website asking about the live Q&A. Word is going far and wide. We got the Graham involved here, checking the connection. So all's looking like it's working at my end. So that's the best I can hope for. When you do these things, you just hope it's working out there. So I'll get going. If you've got a question, by all means, ask away. If you haven't got a question, do not fear. I've got questions of my own that have been sent in by viewers over the week. So thank you to all those people who sent in questions in the last 7 days. And I shall use this opportunity to get cracking, if that's okay. So I'm going to start off with this one. This is a question that was raised. Someone sent in an email saying, do we perform umbilicoplasty at our clinic? So a lot of plastic surgery is people use fancy words for stuff. And umbilicoplasty is one of those fancy words. And essentially, plasty just means changing the shape of. I've got to be careful moving the microphone because it often cuts out. And umbilico is umbilicus, belly button. So do we offer changing the shape of belly buttons at the clinic? Well, yes, we do change the shape of belly buttons. Umbilicoplasty is actually a thing in itself. Now, umbilicoplasty is usually the term that is given to resighting the umbilicus when we do a tummy tuck. So part of a tummy tuck involves resighting the umbilicus. So there's different ways of doing that, of recreating a new umbilicus, or at least resighting the original umbilicus when you do a tummy tuck surgery. So that's, if you sort of talk about it in plastic surgery literature, I've actually written a paper on umbilicoplasty in that setting. And usually if someone's asking for a standalone umbilicoplasty procedure, in my head I'm thinking they've had a tummy tuck and they don't like the shape of the belly button. It might be that they've always had a belly button that they don't like the shape of. Maybe it's an LT, you've got a little hernia or something. In this, so the simple answer to the question is yes, we do umbilicoplasty. We do change the shape of belly buttons. In this occasion, this patient has now sent us a photo, and belly button is horizontally orientated, and she prefers it to be vertically orientated, which is one of the features of an aesthetically pleasing belly button. And the problem with this is that she's got some lax skin around the abdomen. I don't think she's allowed us to show the photo, unfortunately, so I can't show the photo. But it is more than the problem of the orientation of the belly button. So we can't just change the orientation of the belly button. It's the laxity of the skin around it, and it's a difficult problem. I don't think she's got enough for a tummy tuck, which would involve reshaping the belly button. And often people don't like their belly buttons when people who need a tummy tuck don't like their belly buttons, and that is part and parcel of it. But if the main problem is the belly button, I guess a tummy tuck is obviously a bit too big of a thing to suggest for someone who's saying I just want a belly button changed. But the bottom line is I haven't got anything good to offer to just affect that belly button. So yes, we do offer umbilicoplasty. I don't know if the individual who sent in that particular query is watching, but but it's usually people who had surgery. I put it that way. It's usually people who had a tummy tuck who are unhappy with the shape of the umbilicus. That's usually when you're changing the shape of it. It would have to be a specific issue of someone who hadn't had surgery on the umbilicus. Some people don't have an umbilicus, gastroschisis, easy for me to say, probably said it wrong, but when you're born with an anterior abdominal wall defect, sometimes you don't have an umbilicus. So umbilicoplasty would also include creating an umbilicus where there wasn't one there, or if people have had a hernia repair in that area, they sometimes actually remove the umbilicus. So again, that would be fall under the umbrella of umbilicoplasty. So Yes, we do umbilicoplasty. So it's just, I just feel sorry that I wasn't able to help that particular patient who asked that question, but that's explaining why, if you're watching. I think it's more of a global problem with the lax skin around your abdomen. What we got, Chloe. Hi, JJ. Hope you're well. I'm 6 weeks post-op now. It's gone so quick. Crazy, isn't it? Unbelievable. I mean, we're not Feb, are we? No, it's February tomorrow. I just wondered if I'm okay to not wear the support bra 24/7 now, or shall I still keep it on and to sleep with it? I normally see people around 6 weeks, so I'm presuming I'm not seeing you. Anyway, let's do it here. Why not? Why not? Yes, is the answer to that. I mean, I normally see you around 6 weeks, see how you're getting on, have a look at your scars, and just see how you are. But in general terms, 6 weeks is the sort of time where you can see how you go without the support bra. You don't have to wear it at night. Sometimes it swells, sometimes it hurts, so you might want to wear it at night. But if you're at the stage where you're thinking, you know what, I'm getting a bit cheesed off with this and I want to see how I go without it, by all means do go without it. I normally, points on the 8th, okay. I normally say it's about 3 months for things to properly settle. So you're kind of halfway there in terms of the settling. So there still will be a bit of swelling, maybe, a bit of discomfort and what have you. So you might choose to wear your support bra for longer. There's absolutely no harm in wearing it for longer. It's not so bad in this weather, but in hot weather, I know a lot of people don't want to wear it sort of day and night. But if you are finding it annoying and you'd rather not wear it at night, and particularly not even the day, sometimes then don't wear it. But if you are doing anything energetic, going shopping, or obviously if you're doing sports and things, you might want to wear it as a bit of extra support. But bottom line is, yeah, you can see how you go without it. Is the short answer to that one. Can we remove a sebaceous cyst located inside the nostril? Wow, where did this come from? I guess I'd have to see it, really. I'm trying to envisage it. A sebaceous cyst inside the nostril. Did like a mole inside the nostril a little while ago, which was, relatively, in as much as anything can be simple, I suppose. You're welcome, Chloe. But a cyst is kind of underneath the skin, so I'm kind of trying to think where it would be inside the nostril. I mean, that way is kind of the roof of your mouth, basically. So it's not going to be that way. If it's just under the rim here somewhere, so maybe I'm going to say maybe to that, because if it's kind of inside up there, then no, we that would probably be an ENT surgeon, an ear, nose, and throat surgeon, who would have the tools and look inside the nose and do that way. But I kind of think, how would you know it's there if it's kind of up there? I mean, sebaceous cysts are usually just underneath the skin, so I would think it would probably be more like here. But so I'm trying to envisage it. I'd have to see a picture, I think I would say, on that one. I'd have to see a picture of that to see whether we could remove it or not. Always happy to review photos. If you have a question and you want to know, can we remove this? Can we do this tattoo removal? How much to have that lipoma removed or whatever? Send us a photo, and it's a lot easier to give you an idea of what we can do, how much it's going to cost and stuff like that. The other thing about sending photos, people as a general rule tend to send photos a bit too close up. So it's hard actually to see what part of the body is. So if it is, you want to show a bit of detail doing close up, fine. But it's quite helpful to do a far away one as well. Just go and say, oh, that's an arm. Because sometimes you don't know if it's an arm, if it's a leg, if it's a thigh, if it's a back, and sometimes people say it's the leg. And you're thinking, is that the ankle or is that up by the groin? Whereabouts on the leg is that? Sorry. I guess up by the groin would strictly speaking be the thigh, but I think people still call the thigh the leg. So still included in the leg. Do you need to have a capsulectomy if having implants removed completely? So when this is talking about breast implants which have a capsule form around them, which is a normal part of having an implant of any description, really. Doesn't matter if it's a breast implant or a knee implant, knee replacement, hip replacement, cataracts, heart valve, any sort of implant, anything that gets inside your body will wall it off in scar tissue, and that scar tissue is called a capsule. The problem with breast implants is they're sort of squidgy, so that capsule contracts as it always does. And because it's squidgy, it gradually contracts around that implant and makes that implant feel harder and harder and harder. And people say, my implant's gone hard, I need to have them changed, I don't like them. And we say, fine. Strictly speaking, it's not your implant that's gone hard. It's the scar tissue around the body that has gradually contracted around that implant, meaning making it feel hard. And it can feel like a rock. Now, when you remove the implant, the capsule is often just scar tissue. Sometimes, if it's been in there for a long time, it can actually be calcified, so the capsule can be quite hard. But often, the capsule in itself is not hard. The capsule is just scar tissue. And when the implant's out, the capsule does not need to be removed. So if you're going to put another implant in, well, then yes, because you don't want that scar tissue around the next implant. So then, yes, you do need a capsulectomy. Well, you have a discussion whether you have a capsulectomy, but you usually need to have something done to the capsule if you're going to have your implants replaced. So that could be a capsulectomy, which is removing the capsule. It could be a selective capsulectomy, so like perhaps an anterior capsulectomy, particularly if the implants are underneath the muscle. People often worry about doing a posterior capsulectomy because it's right there, sort of on the ribs, and there's a risk of creating a pneumothorax or going into the lung cavity and things when you do a posterior capsulectomy of a submuscular implant. Or a capsulotomy, which is actually scoring the capsule. So it's not removing capsule, just scoring it to let the new implant in. Anyway, either way, if you're removing the capsule and if you're replacing the implants, yes, you often need to do something with the capsule. If you're not replacing the implants, so if you're just taking the implants out, you do not need to have a capsulectomy. You can leave the capsule. Now, you might say it's all hard. It won't be all hard when the implant's out. It's hard because it's contracting around the implant. When the implant's out, it's sort of like empty bag. So it won't be hard. Now, obviously, if there's calcified bits, if there's rock hard bits, we can remove those, but that's only for very old capsules. Most capsules are fine just to leave behind. Now, sometimes people want the capsule to be removed because they're worried about things like ALCL, which is a cancer of the capsule, and breast implant illness, which people associate with the capsule and want a total capsulectomy, which is fine. So if you kind of request a total capsulectomy, that's a bit different. So you don't need a capsulectomy, but if you want one because you believe you're worried about ALCL or you're worried about breast implant illness, then a total capsulectomy can be performed, but it is a bit of an extra level of complexity if we have to do a total capsulectomy. So removing an implant is a relatively simple procedure. A total capsulectomy means you have to actually cut out that capsule. It inevitably takes out some volume. The capsule will have some volume. Inevitably, some of the scar tissue, some of the breast tissue is removed when you do that. So there is a risk that some of the breast tissue removed, so you remove some volume, and it bleeds, so there's an increased risk of hematoma, and therefore you often need a drain, therefore that will keep you in hospital overnight, and so it is a bigger deal having a total capsulectomy. But by all means, if you're worried about, as I say, ALCL or breast implant illness, or if you've read somewhere or you've decided you want to have the capsule removed because you don't want any trace of the implant, then that's absolutely fine. But it is a slightly more difficult, more convoluted procedure to have done, but it's certainly doable. But if you ask the question, does it have to be removed? Usually the answer is no. It does not have to be removed. But as is the case with much of cosmetic surgery, a lot of it is patient's choice and what they desire, and it's weighing up the risks versus the benefits of doing that. So Tion Dabit, can you do a tattoo excision on the neck? Yes, you can. So the main thing about tattoo excision is, I always say it's the size of the tattoo, or at least specifically the size of the tattoo in the shortest dimension. So kind of like a round tattoo's bad, but if you've got a really big tattoo, but if it's quite long and thin, that's good because the shortest dimension is quite short, because that means we can close it. I mean, a long scar, but the shortest dimension is important. So the shortest dimension is important, and also the location of the tattoo. So actually the neck has got a bit of elasticity. Now, of course, you have to move the neck. That's why it's got, but it's not a bad place to have a tattoo, to have an excision of a tattoo, because it has got elasticity. Clearly, we'd have to do the size of it. If it's a really big one, we wouldn't be able to excise it. But if it's kind of a linear thing or something, then that would lips on my neck. Yeah, lips are kind of often quite almost round, so we'd have to see. Usually is possible, but it might need what's called a serial excision. So sometimes if we can't get it all out in one go, we get a bulk of it out and leave a bit of the tattoo. So you have a scar, a bit of the tattoo on either side. You leave it 6 weeks, and then you come back and you have it done, the last bit done again. It's called a serial excision for bigger ones. Send us a photo if you haven't already. I'm trying to think if I've seen a photo. But anyway, send us a photo if we haven't had a look at it, and we can give you an idea. But in principle, for sure. Now, the only thing, if you're having it excised, it would leave you a scar. So that is something to consider, whether the scar is going to be preferable to the tattoo. But that's always the case for tattoo excision. You have to weigh up the risks of well, not the risk, it is going to leave a scar. The downside of leaving a scar versus the upside of getting rid of the tattoo. I always say with tattoos to try laser first, but I'm assuming, well, it might be red if it's lips. It might be coloured, and the ink, the laser struggles with coloured ink. So if it is red, I think laser will struggle with that. But if it's not red, it might be worth having a talk to a laser person. We don't do laser; we only do excision. But, yeah. How long do you need to stay in hospital if having a capsulectomy with implant removal and a breast uplift? Well, I just said a minute ago, if you're having implant removal, you don't need a capsulectomy. Anyway, so implant removal and an uplift, common operation, because obviously if you're having your implants removed, you're going to lose volume, you're going to lose shape. So often you would combine that with a breast uplift to bring the shape back. It wouldn't bring the volume back, but it would bring the shape back, make them less droopy. As I say, the big thing here is a capsulectomy, because if you're not having a capsulectomy, if you're just having an implant removal and a breast uplift, well, that can be done as a day case, no drains needed. That's quite a reasonable day case procedure. The capsulectomy is the issue, because the capsulectomy, as I say, creates a scar, sort of raw surface, and that can then bleed. So there's an increased risk of bleeding, increased risk of a hematoma with a capsulectomy. So we will often use a drain. There's not many operations nowadays where people use drains, and certainly I'm using a lot less drains, a lot fewer drains than I used to. But capsulectomy is one of those ones where I still do use a drain. And if you have a drain, then that will probably keep you in hospital overnight. Sometimes if we're doing it in the morning, we can have a look at the drain in the evening. If it's not got much in, we can remove the drain and let you go home. A lot of the surgery / all of the surgery at the moment is being done in Liverpool. So you probably won't want that hanging over you, whether you go home or not, and going home late in the evening and stuff like that. I won't get you go home late in the evening, but sort of later on in the day. So it's probably, if we're talking capsulectomy, I'm going to say that's an overnight stay because of the drain. But as I say, if you're not having a capsulectomy, if you're having implant removal and not replacement, you don't need a capsulectomy. So you're not having a capsulectomy, that could be done as a day case. But if you do want that capsule removed, I would say that would push it into an overnight stay. How long after stopping breastfeeding can you have implants? So how long after stopping breastfeeding? So it's kind of like also how long after having a child as well. So I guess that question depends on how long you're breastfeeding, because I normally say ideally you want to wait till the child's 1. So, if you stop breastfeeding at 6, so, if the child, because the child's a little bit more mobile, your breasts have had a chance to recover, your body's had a chance to recover, because your body's a little bit hypercoagulable when you first have a child, increased risk of clotting. So you want that to settle, and you want to obviously deal with having a newborn baby. So I think your child being 1 year old is ideal. People do have surgery with 6 to 12 months, but I think it's a difficult age to manage the child if you're just having surgery. Now, specifically asking about the breastfeeding question, the thing about breastfeeding is your breasts will get bigger when you're breastfeeding, and then when you stop breastfeeding, they will get smaller as the milk subsides, and so you really want to know where you're going to be before you start looking at having breast implants, because you don't want to put breast implants into a breast that is still changing in size and shape, because the size and shape of the implant might change if you're breast changes shape on an ongoing basis. So I would say you want to kind of wait probably around 6 months after breastfeeding to let the tissues, to let the breast settles. Whenever people ask questions like this, we always kind of give answers like 6 months and things. A lot of it I would say to people is listen to your body, see how you feel, and you will know yourself how things are changing. So if things are continuing to change at 6 months, we might say, well, do you want to leave it a bit longer? Leave it a few more months, just let everything settle down. Or if you think, the last 3 months nothing's happened, you might say, okay, well, so I would say 6 months is a good ballpark to give your breasts a chance to settle, to let the size and the shape settle, so we can get an idea of where we're going to be, so then we can know how to plan for the size and shape of implant that we're going to use. I want breast implants or fat grafting to my breasts. I am worried about having implants in case they need changing after 10 years, but I would like to only have surgery once. Is fat grafting better? What would be your advice? Yeah, so in that regard, yes, fat grafting is better, because the worry with implants is they might need to be changed. Now, they don't, strictly speaking, have to be changed every 10 years, but they may well need to be changed at some point. Probably the most common reason for changing them is capsular contracture, the hardening of the implant, which happens around 5 or 10 years. So that is definitely something to consider. If you're having implants, you may well need to have them changed. And so in that regard, fat grafting is a better option, because fat grafting is a permanent solution. Once it's taken, it's taken. That's it. That's you. There's no problem with having it changed or whatever. So as you grow, as you get bigger, if you put on weight, you get bigger. If you lose weight, you get smaller. So in many regards, fat grafting is a superior alternative to breast implants. However, if you look at how many cases of fat grafting that certainly we do compared to breast implants, hardly ever do fat grafting, to be quite honest with you. Well, I won't say never, but basically never. I mean, I did the last fat grafting for a cosmetic breast augmentation is, I don't think I had the clinic more than 10 years ago. Used to do a lot of fat grafting for breast reconstruction, different kettle of fish, but fat grafting for breast augmentation in my hands is a very rare procedure. Why, you say? You just said that it's really good because it doesn't have to be changed, it's natural and it goes with your body and all that. True. The problem with it is it's subtle. The volumes are small. I don't think we've quite got it yet for the high, big volume fat grafting. So we're talking, I mean, basically people who want breast implants are often quite slim, so don't have many donor sites. That's another problem. So the slimmer the person, the less donor sites they have to harvest the fat from. But 80 cc's, 100 cc's, if you did 120, that would be a big one. So I'd say 80, 100 cc's is kind of, would be a big fat grafting for me. But an 80, 100 cc implant's really quite small. So for that reason, you often need to have it changed, repeated. Not because anything happens to the fat, but just because you can't put that much fat in each time. So you often have to put more fat in. So you often have to have multiple procedures. And each procedure is almost as expensive as the first one. Hi, Lisa. As breast implants. So breast implants, you can put, take a 280 cc, 320 cc implant off the shelf. In it goes. That you're, it's going to be 280 cc's bigger. You're going to be you can be predictive about that. You know where you are. Fat grafting, a little bit unpredictable. You never know how much fat you can get in there. Also, there are potential problems with fat grafting, but having said that, there's potential problems with implants too, in terms of fat necrosis, oil cysts and things. But the main issue with fat grafting is the volume, is the size. And as I say, it's quite expensive because it's quite light labor intensive. It takes quite a long time. You can't just suck the fat out and put it in. You have to process the fat before you inject the fat, and you have to inject it in very small little aliquots so that the graft takes. So it takes quite a long time. So the operation takes a long time in theatre, so therefore it's an expensive procedure. As I say, it's almost as expensive as having implants, and the volumes are a lot less. So it is not, unfortunately, as popular as you might think based on what you see on paper, with it having none of the risks of implants. Whether it will get more popular, I don't know. I think a lot of people these days talk about using what's called a hybrid procedure, where they use implants and fat grafting. particularly in people who are very slim, who would otherwise have the implant underneath the muscle. So they say instead of putting it on the muscle, they put the implant in, put fat graft over the top. I think that might have some mileage. Again, it's going to be an expensive operation because you've got the fat grafting and the implants. So that's doubling up the price. Whether that's justifiable, whether you would see a difference in someone who's had a hybrid breast augmentation versus someone who's had a breast augmentation without fat grafting, who knows? Obviously, if you get a problem, you might say, well, it was worth it. But if you don't get a problem, it's a tricky one. All I'm going to say is a tricky one. There's no answers out there. This is the thing people are playing with. They're playing with these hybrid fat grafts and things like that. Hybrid breast augmentation using fat graft and implants. I like it in concept. I think you'd have to charge a lot, and I'm not sure if you could justify that fee based on the results, in my view. Because I'm not sure if the fat graft would add that much to the implant result. Although, as I say, if it can avoid putting them in a submuscular plane, but can you get enough fat over the top of it to reduce the risk of rippling, etc.? It's a tricky one. No answers here, but on bottom line, you can't really say fat grafting is better than implants. They've both got pros and cons, and it's about making a decision about what's the right thing for yourself. If you have a cyst removed on your scalp, will you be left with a bald patch? Not what you might think. I think a lot of people think you're going to have a big bald. Well, there you go. Don't have to pretend. Big bald patch. So in that regard, no, you're not going to be left with a big bald patch kind of around where the cyst was, and you'd be embarrassed going to work and stuff like that. Personally, I don't sort of shave the hair, or I think some people might. So this might be specific for me, because I think some people, it is difficult stitching in the hair when you've got a lot of hair, and I think some people just shave a bit to make it easier. But I don't shave any of the scalp. The only thing I would say is that if you are having something removed from your scalp, whether it be a cyst or a mole or whatever, the scar from where you have that thing removed will not have any hair on it. And what that means is that there'll be hair on either side, but there'll be no hair on the scar. Now, that doesn't matter if you've got a lot of hair, because you'll hide it. And it doesn't matter that much if you're completely shaved bald. If you completely shave the skin, because it doesn't really show then either. The problem comes if you've got buzz cut, like myself, trendy, yeah. If you've got a sort of short cropped hair, same with the beard. If you've got a short cropped beard, you'll have a defect on it. You'll have a line in the it's all white there. It looks like there's nothing there, doesn't it? You'll have a line in the hair, so it can be a bit more obvious for people with shorter hair. So that this, as I say, the scar itself won't have any hair. Whether you're going to call that a bald, I wouldn't necessarily call that a bald patch, but I would call it a sometimes you see people with a defect in their hair, and that's due to a scar which doesn't have hair on it. So if you're going to call that a bald patch, well then yes, you do get a bald patch when you have cyst removed. I would call it, we call it scar alopecia, no hair on the scar. So yeah, just be aware of that. If your hair is short, if your hair's long, it's just going to be here. You're not going to see it. Can we remove a growth located on the eyelid that is impacting vision? Wow, I'm trying to picture this. I haven't seen a photo of this. Quite like to see a photo. I mean, it sounds pretty bad. I've got to be honest with you. It sounds pretty bad. So on the face of, if that's all I've got to go on, I'm going to say no. I'm going to say probably we will. I would probably say that would be an ophthalmic surgeon. I mean, have a look at it. I mean, if it's just like a warty lesion that you can kind of see out of your eye, and it's just like a raised lesion on your eyelid, I guess yes. So maybe, I guess, is the answer. No/maybe is the answer to that question. I'd have to have a look at it, but perhaps not. Might be an eye surgeon. Might be better. If it's just a simple skin lesion, we can definitely remove it. But sounds like it might not be a simple skin lesion if it's impacting the vision. Do we offer bum enlargement? One word answer: no. No, never have. Never have. It's been a controversial topic within the plastic surgery world. I think other parts of the world have done bum enlargements and certainly wax lyrical about it, say it's a huge market and there's loads of people out there who want it and we're missing a trick by not offering it. I've heard that said many times at these meetings, and that might be right. I've never really sort of gone down that route. I've never really done it, to be honest with you. But it is coming back now, and they're saying there's safe ways to do it, and certain people are giving, trainings on it and things like that. I mean, there were some fatalities, so that's why it went out of fashion, not unreasonably, but it's coming back now. But I don't think I'm going to be involved in it. It's not something I really want to start doing at my advanced stage of my career. But so we don't offer bum enlargement. Breast, tummy tuck. I know we say body, you might say that's body contouring, but I'm like, yeah, it is. So in that case, breast and body contouring in brackets, not bum enlargement. At the moment, I mean, I'll keep it open by saying at the moment, but yeah. I am a transgender woman. Does your clinic offer breast enlargement? So we do offer breast enlargement, but not for transgender women. Breast enlargement for transgender women is a specific niche of plastic surgery. And there are specific plastic surgeons who work with transgender, male to female, female to male, both ways. So, and on paper, the surgery is kind of the same because, some women are very flat chested and you do breast implant for them. So doing it on a biological male would be a similar kind of thing. But in practice, this work is done in what's called a multidisciplinary team with psychologists and endocrinologists and all sorts of people who, gynecologists, urologists, plastic surgeons, and I'm not in one of those teams. So I haven't spoken to Guy for a while, but Guy Stern used to be the plastic surgeon in the West Midlands, or at least I used to work with him at City Hospital, who did this sort of work. And so I just referred everyone to Guy because he was in the multidisciplinary team. So if this person is on the line, I would say Guy Stern is the person to see because we don't do that surgery at the clinic. Do we offer skin grafting to the face? Funny question that. Now we're all plastic surgeons, so we all do skin grafts, and yeah, we could put a skin graft on the face. I just think it's a funny question. It's like, so can we put skin grafts on faces? Yes, we can put skin grafts on faces. I'm thinking that question is probably coming from a place of skin cancer, which is probably the most common. I'm hoping a skin cancer rather than tattoo, because I don't like doing skin grafting for tattoos. But skin grafting is sometimes required for skin cancer. So, we could do skin grafting to the face. Is the answer to that question as it stands there. It's not a common thing that we do at the clinic, to be honest with you. We don't, skin grafting to the face is not a common procedure, and I have done it, but on a handful of people really. Personally, if you've got a skin graft on the face, hi Mrs. B, or at least if you've got a skin cancer on the face, personally, I do like to do flaps rather than grafts. A flap is moving a bit of skin across to cover the defect. I feel it's cosmetically better. However, if it's in a particularly difficult area with limited options for a flap, or if you're worried you're not going to get it all out, then a skin graft might be an option. So never say never. We've got Azam Faroa, who does a lot of skin cancer work. He's a specialist in skin. So he does a clinic on a Thursday. So he's probably the guy who does more skin grafting to the face than anyone else. I'd probably be the least. Costas does a lot of facial work, a lot of NHS. These guys work in the NHS. You see the sort of thing you do a lot of in the NHS. I don't do, because yeah, that's the other thing. If you've got skin cancer on your face, the NHS will probably treat it for you. But if you want to come, I'm not trying to put you off. If you want to come and see us, fine. But we don't do much of it. I don't anyway. Costas and Azam probably do more. That's that. Good bunch of questions there tonight. I think you'll agree. Very grateful to all who submitted questions, and to Chloe and Tondaby for asking questions live and direct. Someone else. I will be here, same time, same place next Tuesday, 7 o'clock. I will very much look forward to seeing you then. If you've got any questions, put it in a comment or email us or give us a ring, and we'll put it on the list for next week. Or we don't have to put it on the list for next week. I'll just answer it there and then. I'll just email you back or whatever, or ABWell or whatever. So I hope you have a lovely evening, and I very much look forward to seeing you next week. Alex Rose has come in with earlobes. Oh, roughly how much does it cost to fix stretched 5mm earlobes? Oh God, you want a price live on the thing? I don't know, Alex. I don't do the prices. I'm just looking if I can find a price list. I'll start talking if I don't even know where they keep the price lists. So yeah, that's quite a common thing. Fixing stretched earlobes is for sure a thing. What I would say, Alex Rose, is can you direct message, and then we'll direct message back. Let's have a look, price list. So the one thing I would say to you, Alex, is there is two prices for this sort of thing, depending on whether you have you keep a hole for your earring. If you want to keep a hole for your earring, there's a bit of a fancy technique to doing it. Well, not probably. The easiest way to do it is just to remove the enlarged lobe and close it. So right, there. But yeah, definitely something we can do, Alex, at the clinic. No problem. It will be both ears. I've been told £1,000 each ear. Right, let's have a look. Well, there you go, Alex. What are you asking? You've been told by us, or if that's it, that's it. Here we go. I've got to be honest, I do feel uncomfortable talking about. Here we go. Oh, well, we've got 998 one and 1398 1400 for both. I would. All right. 998, yeah. I don't know, Alex, don't quote me on that. That's what I've got there. I might have got it wrong. I usually, when people ask me to do things which are outside my remit, I get it wrong, and I get told off. But anyway, that's what it says here. 998 for one, 1398 for both. It's usually not. It's usually not double for the second one, because you've already got one pack open, so it's usually like less for having the second one. Similarly, if you're having two procedures done, it's usually less to do the second one than it would be to do the second one on its own, sort of thing. So if you had one done one day and the other done the other day, yes, it might be £1,000 each time. But if both done on the same day, it would be less. There is an economy of not scale, what word would be, volume or something. But yeah, that's what I've got. I've got 998 and 1398. Let's call it 1,000 and 1,400 for both. But you better contact, and you'll say he said that anyway. Yeah, please don't ask me prices. I'm not very good at it. What is the normal average time for a muscle to relax after a breast augmentation? Normal time for a muscle to relax. The problem, Mrs. B, I think what you're getting at, correct me if I'm wrong, is that they're probably sitting high. That's what I'm sensing. I'm sensing they're sitting high, and you're thinking the muscle's got to relax to let them settle. Now, they sit high whether they're under or over the muscle. So if I'm on the wrong track, just stop me straight off. But they are more likely to sit high when they're under muscle. The muscle can hold it up. So I normally say things kind of start at about 3 months is my go-to for when can it look kind of normal, but I don't think it's finished at 3 months. But certainly in the first few months, it doesn't look right, particularly when they're under the muscle. The muscle can hold the implants high. So so the first few months, I wouldn't be too worried. 3 months is kind of when it starts to get an idea what you're going to be, but you're not probably not at the end. 6, 12, 18 months to really get to settling and feeling like their own and looking like your own. Yes, kind of. But I also heard that after the muscle needs to relax if you go under the muscles. Yeah, I don't really think it's the muscle relaxing. I don't think it's the muscle contracted, sort of constantly contracted for 3 months. I think it's just the muscle holds the implant high. And as I say, it happens when they're over the muscle as well. It's just more, it's more of a problem when they're under the muscle. And gravity will help to let them settle into the pocket. The pocket will have been made there, which is quite frustrating for us as surgeons because we make the pocket, we put the implants in the pocket, we finish the operation, and we think it all looks great. And then you wake up and dressing's all that, and then you think, what's going on? Why do they look like that? And it is frustrating because they do sit high and it doesn't look quite right, and it takes a while for them to settle back down into that pocket. So whether it's muscle relaxing or gravity or whatever it is, it does take at least 3 months, really, I would say. I don't know where you're going to tell me. Where are you now? Are you 3 months yet? But 3 months is where it starts. As I say, it might not be 100% at 3 months, 6, 12, 18 months to properly settle. But hopefully 3 months, you get an idea where you're going to look like. In the time before 3 months, I wouldn't be too worried if it doesn't look quite right, because it often doesn't look quite right. And sometimes one's high and, all that sort of stuff. So I wouldn't be too worried if it's not quite right. Now, but Mateus NXO, you asked to be in the live video. I can say yes, which means it's not understood, which means you will join me live. Do you want to do that? Do you want to join me on a split screen thing? The Facebook people won't be able to see it. Shall I say yes? Or is it not? What's not understood? Is it the muscle that's not understood? The muscle thing? Oh, it's gone. You don't want to join me live. The bottom line is, Mateus, is that they sit high when you first have it done, then they settle. I just want to know what was normalish for settling. About 2 weeks post-op and having a bit of anxiety. Thanks to you. Yeah, very normal to have anxiety at 2 weeks because you've been waiting for this for a long time, and people get upset when it doesn't look how they want to look. But I always say, I say it on pre-op, it takes about 3 months for it to start to settle. And yet everybody will worry when they don't look right at 2 weeks. It's very normal. But stick with your surgeon, keep close with them. Surgeons say different things. Some people get you to massage, some people use straps and things like that to help them if they are sitting high. So just do what their sort of practice is. But in my experience, they will settle kind of whatever you do. Those things can help it. They don't always settle as well. Sometimes they don't settle. So I'm not saying it will settle. I'm just saying it will change. So, sometimes you do need to do things to people. You do need to lower the implants, particularly if they're under the muscle. So that is a thing. But just, try not to worry too much about it at 2 weeks. Just worry about the healing and stuff like that at 2 weeks. But yeah, it is difficult when they don't look right. But you're not alone, Mrs. B. You're not alone. Mateus, do you want to expand on what's not understood? Or not? Is it the muscle thing? I wouldn't get hung up on the muscle. Just basically implants start a bit high and then they settle. For whatever reason, whether it be muscles or whatever. Anyway, Mateus, call me if you want me to explain the something. My surgery was in Lithuania, and here you go. There you go. Right. Well, yeah. Well, we used to still try and get an idea of the post-op regime from him or his nurse or whatever, because it's not really. Everyone's got different views on it. It's not really a sort of set thing that everyone does this or everyone does that. Everyone does massaging, everyone does straps, everyone does this or that. All surgeons have their own kind of view on that. So it's probably better to get your surgeon's view on that one. So there you go. So yeah, okay. So Mateus, by all means, give me a call if you've got any questions. If something's not understood, I will. Bobby Perks is in the house. I will. I'm just checking out Bobby. Actually, feel free to ask a question if you've got one. But I've had a tranche of questions, and I'm going to use this opportunity to exit stage left, as they say. And I will bid you good night. Hi, Bobby. Hi. And I will, but don't fear. I'll be back next Tuesday, so let's not panic. And I'm very much looking forward to seeing you all. Same time, same place. I say same time, same place. Kind of 7 o'clock more than 7:48, Bobby. Yeah, but you know, you can always watch the replay if you are such inclined. So that way inclined, or if you want to. Okay, so